First, let's get into some more of the numbers involved in this survey. Jamie Jenkins is a health commentator who's a former head of health statistics at the Office for National Statistics. Hello, Jamie.
Hi, Nick. Good evening.
So what can you tell us about this new survey?
Yeah, Nick, so it's probably worth just starting how big is this survey. So a lot of people responded. So what happened was a survey was sent out to 2.4 million people across the country, and we had about 720,000 responses to it, which is about 29%. So you might find that those who are kind of most gruntled and want to make a complaint would be those who respond. But when you're looking at things over time then and comparing things, that would be the same in each year as well. So I think a couple of the things that point out to me is the fact that now last year when the survey was done, about 11% of people avoided making an appointment because they found it was too difficult. And that's gone up from 11% to just over a quarter, so over 25% now, which is quite a lot. And remember now, this is at a point where we know that people have been complaining about struggling to get appointments with GPs. And the thing for me on this, Nick, is how much of this protect the NHS, stay home, save lives has kind of programmed the public, I suppose, to not go forward when they've got that niggly thing that, say, 3 or 4 years ago, they would have come forward for. Because we do know when you look at the survey that some people have said that they haven't gone forward to get that appointment with a GP because they don't want to put the burden on the NHS, where ultimately the public should be going forward for those appointments because that's what GPs are there for.
Yeah, but if they find, I mean, I'll just give you my experience. You try to get an appointment with the GP, you call up and then the recorded message says, we're not taking phone calls because of high demand. Please go to our website and book on the website. So you go to the website and the website says, due to high demand, we're only taking internet requests between the hours of 9 a.m. and 10 a.m. every day. As you didn't get lucky today, please try again tomorrow. I mean, you might as well not have the GP there at all. It might as well not exist.
No, indeed, and I get a similar experience. It's not quite using an online booking system. If I try to phone the GP at 8 o'clock, I've normally got 3 different phones trying to phone in at the same time, trying to get through for that. And what we do know is if you look at the number of GPs per head of population, so how many actual GPs there are to go around, that has fallen. And Jeremy Hunt, when he was the former health secretary, he was trying to get more and more GPs into the system. But what we're finding is the number they're training, Nick, to come into the system is not really enough to offset kind of those who are either going part-time because they're reaching kind of the age where they want to reduce their hours, say over the age of 50, or those retiring. And when you look at the UK overall compared to, say, some comparable EU countries as well, we don't seem to have the number of GPs per head of population to allow patients to get all these kind of appointments. And that's not an easy fix overnight. And, you know, we've got this leadership election for the Tory party at the moment, all this money going into the NHS. But I think sorting out the GP system is primarily one of the top things they need to sort out, because what happens, Nick, as you talked about, you can't get the appointment with the GP. What do you end up? You go down the hospital, then you put a pressure on the kind of the hospitals and the A&E services are down there as well.
Right, so why are there so few GPs now?
Well, that's in part just by poor planning. We've never really had a proper workforce planning system in the NHS where you look at the population, you look at the ageing of the population, and we know even if the population remained the exact same number, but it is growing if you look at the ONS stats, Nick, that people are getting older, and you tend to find that as you get older, the demand you need on the kind of the GP services gets more as well. So we've not properly, this is an historic thing. You can't just blame Boris Johnson and the government for this now. You've got to go back to David Cameron, to Tony Blair. You know, you've got historic problems where we haven't trained enough doctors to look at the future demands on the NHS. That's why we're in the crisis that we're in now. And you can look at the ONS figures this week, Nick, which is looking at, we've seen over the last 3 weeks, 3,000 more deaths above average for the time of year than what you would expect. And this excludes all those deaths related to COVID. Now, how much of this is down to the fact that, as has been said in the survey, people are avoiding coming forward for healthcare because either they can't get the appointment or they don't want to burden the NHS? How much is that causing people to not get those diagnoses, which means that we've seen more people dying than what we would expect for the time of year?
Is there something specific about the position of GP as opposed to any other specialisation in medicine that makes people not want to do the job?
Well, I suppose with the way the GPs work, they've talked about kind of reforming the contract and trying to get people to actually work weekends, and they're threatening to kind of go on strike and all this kind of stuff. The problem, I think, with the GP system as well is that they kind of get paid by how many patients are on the register rather than how many patients they see. So it doesn't really matter if people can't get them forward. If you've got more and more patients coming onto your register, that's what kind of looks at the funding with all of this. I think, we need to get back. We're never going to get back, Nick, to those lovely days back in the kind of the 70s and the 80s where you had a named GP. You'd see the same person all the time. They come around, see a young child if they were ill. But we really do need to kind of look at the system. And ultimately, we talk about the billions that go into the NHS overall. We want to stop patients going into secondary care, which is obviously the hospitals, and looking at fixing problems. We want to get those primary diagnoses much, much earlier. And that really needs to be, the new Prime Minister, when they come in, alongside things like energy security going forward, the GP system is, it's the first port of call for most people. We've got to up the numbers. We've got to recruit a load more people over and above who those who are going to retire. That's the critical thing as we go forward now.
I mean, do you suspect that actually what's happening here is the government pushing over the last 12 years, pushing us to go private? Because the difference between relying on the NHS and going private is like staying in a youth hostel compared to staying at the Ritz. If I want a private GP appointment, I could probably get one right now. It's it's in the evening on a Thursday, and I bet I could within minutes.
And that in part is part of the problem, Nick, because obviously why are the number of GPs per head when you look at the NHS system kind of not as high as what we would want is because, these GPs will say they're overworked, they got too much patients, they haven't got enough kind of staff to support the kind of the patient load that they've got. So it's a simple thing. If you go private, and then you've got a much reduced load, and you might be getting more money because obviously the patient's having to pay a little bit more to actually go and see yourself there. So what does that mean? If you can go private, it reduces the number of NHS GPs. So it kind of is a vicious circle there. The fact that if you haven't got enough NHS GPs, some more of them might quit because the demands on them, they will say the stress, the workload means they go private. It makes it even worse. More people may end up going private. I think maybe we need to properly look at the funding of GPs. We pay to go to see dentists. Do we actually look at, people talk about the NHS being free at the point of kind of when you go there. That's not quite the same when you look at dentists. Maybe they should look at how the funding model for GPs work, and for those who cannot afford it, they get free treatment. For those who can afford it, maybe there's some extra money. Rather than raising taxes, you just put a nominal fee for people to go and see their GP, which will allow that extra funding to employ more GPs to reduce that kind of problem as we go forward.
I mean, is the rest of Europe having this kind of problem?
Well, the number of GPs per head across some parts of Europe is much, much higher than the UK. So that's in part why the UK has got a problem. This is pre-pandemic, these problems as well, Nick. We've seen these rises in these numbers in the latest survey showing the dissatisfaction with the NHS, and the GP system's got worse. In part, there's been a lot of criticism for the GPs as well in terms of face-to-face kind of appointments. We know that before the pandemic, 8 in 10 appointments would be face-to-face. That fell off a cliff to less than half during the pandemic. It has crept back up to 64%. But people can't get to see their GP. It is much, much better than comparable EU countries. And that's because they've just got more and more GPs per head of the population. So the chance of you getting that appointment if you're living abroad, say in the likes of Portugal, much, much easier than if you're living in the UK. And remember, every sort of different country's got different healthcare models. And no actual country across the world, really, Nick, adopts the NHS model. So maybe we need to be looking now, radical reform of the NHS, and what's working elsewhere, should that be adopted in the UK? The problem there, though, Nick, is politically, any talk of reforming the NHS is always seen as, this is a bit too far, it'll lose you political faith. And that's why governments successively just don't want to touch it.
Do you think there's also something to be said for the way in which other countries you have, say, a problem with your knee, and, let me talk about here, what would happen here. If I had a problem with my knee, then I would, and it's just a recurring problem, then I would have to make an appointment with the GP, and it might be in a month, and then I would see the GP, and then he would, or she would send me to the consultant. In other countries, you don't have to do that. You can just go straight to the consultant. What would be wrong with that?
Well, definitely, there's nothing wrong with that at all. And I've, on LBC myself, listened when you've discussed this across the station in the past, listened to people who said they've gone abroad or they know people who've kind of emigrated and live abroad, and where they might be on a 2 or 3 year waiting list in the UK, they're getting sorted and fixed within a month over in Europe and in certain countries. So there's absolutely no need why you need to have all of these different systems, this layer of bureaucracy where you have to go here, you have to get a referral, getting those self-referrals. The problem, therefore, some of the managers would say in the NHS is if we adopted that model, you get too many people going straight to the consultants. But that's where maybe looking at the model of how the NHS is funded, how you get these referrals, needs looking at, because if things are working better abroad, Nick, why aren't we looking at them and adopting them in the UK? I'm all for making sure anybody who needs health treatment gets it free if they need it. But where it's not working at the moment, we really need to adopt what's working abroad much, much better.
Yeah. But as you suggest, the problem is that people are wedded to this idea of free at the point of use, almost as though it is free. But of course it isn't free. We pay an enormous amount through our taxes, but it appears to people as though it's free, and any suggestion of doing anything else is greeted with horror. So it does appear as though we're sort of stuck with this.
No, I think we are where we are currently, partly because, Nick, where you find is that, say, for example, the Tory party said today, we're going to look at the funding model of the NHS. We're going to start charging for certain aspects of it to give you a better service. So it might be better outcomes for the patients overall. The Labour Party and the opposition benches would jump on that, saying, look, they're trying to privatise the NHS. Similarly, if the opposition parties tried to do that, the Tory party would jump on that. And in politics, starts becoming more important than the patient experience. And that's part of the problem we've got in the UK with regard to the NHS now, Nick. What we really need is to take the NHS out of politics, get all of the parties, because whichever party is governing the country, this is the same problem. You've got Labour in Wales, the SNP in Scotland, the Tory party in England. You've got the exact same problems across all three countries. Let's take politics out of the NHS, a cross-party approach to look at what is the best way of running a fit-for-purpose health system to benefit the whole of the UK. That's the important thing as we go forward, I think.
All right, thanks for that, Jamie. Jamie Jenkins, a health commentator and former head of health statistics at the ONS.